Hi everyone, Datuk Dr. Inder here. Your doctor is so passionate about hair. Yes, everyone, I am so passionate about hair, and that's why I'm a hair restoration doctor. So today, what I'm going to do is I'm going to talk about the major factors that actually affect on the graft survival rate. So it's so important when we do hair restoration. We have many different steps. That's why hair restoration is a long learning curve. You know, over years and years of doing it, and you get better and better, and then perhaps be the best in the field. Now, I'm gonna talk about major factors that affect graft survival rate. Graft is actually the hair here that we're going to extract, we're going to harvest, and we're going to take out the grafts, and that is called time out of the body, and later do the transplantation over the area that we want to plan for the day. That's the area of the hair loss. Now the seven major factors that affect the graft survival rate. Number one is the size of the graft. If the graft is either too chubby, too tiny, yes, it may affect the graft whether it's going to survive or not for the whole transplantation. Next, we go to the graft transaction rate. When you do a graft, you must, when you're doing the punch, you're scoring the grafts, it should be really entering from the scalp right to the area that is the base of the root of the hair, so that the grafts comes out. A graft with single hair remains single hair. A graft with two hair remains two grafts. A graft with three or even more remains so. That is very important, and that's how you sometimes want to choose the best doctor, because these are the things that affect the results and definitely the naturalness on how the transplantation and how the end results is going to be. Then number three is graft injury. Very important that many times every graft story, you must remember, you know, when we need to extract the graft out, we have to keep the graft out, you know, all by using forceps or maybe implanters, and we have to transplant back into the area that lost the hair. So during that time there may be some injury to the grafts, and therefore that is another thing that you have to be very careful. The next thing is the hydration. The graft, you need to remain hydrated. That's why it's so important to spray all the time. The moment the grafts become dehydrated, that means the survival rate is almost zero. No point putting the grafts and planting it, you know, because you ain't going to see any growth there. Okay, number five will be the incisions at the site density. It's important that you do not put the grafts very close and the distance between them, because every graft that enters in definitely need to survive. They need the nutrients and they need the blood supply. So the different areas and the density at the area that transplantation is very important. And the next, you go to the grafts out of the body. When the graft is out of the body, the time out of the body is again a very important factor, because imagine something here and it comes out, the graft is outside of the body, and then you have to go back into the same body. So that is time out of the body. Very important factor. The sooner you put, the better it is. The last and not the least is how you store the graft temperature. So every graft that we take out, extract out, we put into the chiller. So this chiller is something that we need to maintain a very special temperature. Maintenance of the temperature is so important so the grafts survive. So these are the seven important factors affecting the graft survival. So that is my tip for today. Stay in for more tips maybe on Monday. Alright, okay, ciao for now.